Folks, thanks for joining us today. My name's John Dubois with Premier Marketing, and we'll be spending the next 50 to 60 minutes discussing an entrant into a very competitive market, and that is the Medicare space with the different Medicare supplement carriers that are available to us and to our clientele. We're proud to present an affiliation with National General today. We're going to be discussing how that program can enhance your competitive stance in your markets and make certain that the programs that come into play to support the marketing of this carrier and our partnership with them can make you very successful in your space. We are a big fan of organizations that are able to support not only the agents that offer the programs, but the clients that engage in the plans. And today we have a partner that does just that. You'll notice in today's software that we have a section for both questions and chat. We ask that you put your questions in the questions section. We find that we cover them in most instances throughout the course of the presentation, but we want to make certain that we do that for your inquiries. And so we'll check periodically to make certain that we are covering the information you need covered. Today's presentation is being recorded, and that recording will be made available on our website at premiersmi.com, on our YouTube channel, and if you're working with an agent success manager or marketer with Premier Marketing, they will have that material as well. Everyone who expressed interest in today's presentation as well will be receiving an email with a link to the recording and additional information that we're providing as part of today's presentation. What we'll do to start is make certain that we have a level set as to who we are. Many of you understand who Premier Marketing is, but we're a national marketing organization founded in 1968. That's part of the Integrity Marketing Platform. The offices across the country, licensed in all 50 states. We act as an insurance wholesaler working with independent insurance agents such as yourself, and we offer the contracts for these carriers at the highest possible commission levels with recruiting contracts available. Our approach is through a full program of product for the senior community, the Medicare community. And so by doing so, we offer the basic Medicare programs of Medicare Advantage and Medicare Supplement plans, the standalone Part D prescription drug programs. In addition to that, life insurance and annuity programs, final expense life insurance, pre-need plans, long and short-term care programs, disability income plans, and ancillary benefits such as dental, vision, hearing, critical illness cancer plans, hospital indemnity programs, accident programs, and telehealth plans as well. When we look at the Medicare Advantage partnership, the national carriers are there for you for use through our organization, along with many of the strong regionals that can make a difference for you in your market. And that same philosophy carries over into the standalone prescription drug programs, where many of these are available as part of your contract through the MA programs. A notable exception, the Mutual of Omaha prescription drug program is a separate contract from their other offerings, different from their ancillary products and their Medicare supplements. So it's a separate contract. And the Clever RX program is actually a discount program and not a prescription drug plan sanctioned by the government. When we look in the Medicare supplement arena, we do have an amazing array of carriers available to you, including our new partnership with National General. But we also have the different marketing programs that put into play to make you be successful in this space. We feel it's a necessity to cover the gambit, the range of the needs of our prospects, our clientele, the Medicare population, and we want to make certain that we do so in offerings that cover the entire spectrum of choice, where people of different incomes can choose whatever program may be the best for them. When we look in the ancillary arena in each of the categories, the national carriers are there for you for use through our organization. We work with these programs to cover specific needs, grant us additional marketing opportunities, and of course, create additional revenue streams for ourselves and for our agencies. When we look at the Medicare market overall, you don't come on a program today without learning or hearing once again of the aging of the baby boomers, the silver tsunami, 1 every 10 seconds, 10,000 plus a day. That's a near exponential growth as the tail end of the baby boomers age into the Medicare arena. That's important to note, though, that we're finding that many folks are delaying full access to their Medicare benefits at the age of 65 for one reason or another. and that may be due to pandemic influencing economics. We have to work longer. For those of us in that tail end of the baby boomers, in order to get full retirement from Social Security, we got to go to 67. Whatever. Some folks just like to work. I mean, don't have to retire. So there are many reasons why people are delaying full entrance into the Medicare coverage, but that number is more than made up by the 15 to 17% of the folks that are under the age of 65 and accessing benefits because of medical disability. That's important because we want to look at what choices we have available for accommodating the choices of our prospects and our clients. Because, hey, if they wanted to, they could decline Part B. Thankfully, most don't. Some do because of specific circumstances. Some will actually pick up the Part B, self-insure for the medical costs that aren't covered by traditional Medicare, pick up a Part D to help with some of the medication costs. Some will bundle into the Medicare Advantage plans where the medication coverage is integrated into the programs in many cases. But there's a large number of individuals that choose to select a program that isn't network-based and gives them the opportunity in a standardized, modernized Medigap plan to have freedom of choice when it comes to providers, and then pick up that standardized Part D program to help with the medication coverage. And that's the bulk of our conversation today. What we're seeing as people do enter into the Medicare arena and access their benefits, it's a pretty even split between Medicare Advantage and Medicare Supplement programs to start. You have a portion of the population that still has coverage elsewhere within the bounds of original Medicare through Medicare, Medicaid, retirement programs from work or a union. Perhaps they're accessing care through the VA or they're self-insuring. But the pandemic has changed a little bit of the numbers when we look at the choice between Med Advantage and Med Sup. Still a fairly even distribution between the two. And so we want to make certain that we're competitive in that space and that we can accommodate the needs of the folks in that arena. And it's important because, well, folks on Medicare, well, we have challenges. I say that like we have challenges. I'm not yet on Medicare, but 2/3 of the population have 3+ chronic conditions, and they have some challenges with their budget, income, and assets. And so we want to make certain that the plans we have fit not only their choice of care and that delivery and the payment of that care, but also make certain that it is a system that fits into their budget and we're able to take care of them long term. Some of the things that we want to make certain that we show as well as a translation of some of the acronyms that come into play. This slide does need to be replaced because the Medicare Learning Network acronym guide has been discontinued. They're pushing us into a CMS acronym guide, and I'll have details for that for you as part of the follow-up, a link to that guide. It is, however, a reminder for us as well that we, in the course of our presentations to our prospects and clients, we minimize the use of Medicare acronyms in order to make certain that folks fully understand what we're saying, how we're relating and communicating with the folks that we visit with. These programs are important for us to utilize on an ongoing basis because, well, Kaiser Family Foundation has shown us that regardless of the choice that a person has under Medicare, the majority of them aren't reviewing their plans year over year. And we know what can happen. We know that prices change. We know that drug formularies can all be altered. We know that there's a number of factors that come into play that really predicate the need for a beneficiary to do an annual review. And that includes the programs that integrate into the drugs right into the system with a Medicare Advantage plan, or more in keeping with today's topic, the folks that have a standalone Part D program because they need that in addition to their Med Sup to get the medication coverage. And we want to make certain that even if they're not using the government sites to get additional information or reaching out for whatever means it is for an annual review, we go beyond the election periods because Med Sups are not subject to lock-in. We can market them year-round. There are some special considerations in certain states, but we don't have to worry about a SEP necessarily for someone who has a Med Sup. That is an opportunity for us to examine, however, that if a person has a Medicare Advantage plan, and they're looking to remove themselves from that coverage and seek a Medicare supplement, well, sometimes these SEP special election periods allow us to do so throughout the course of the year because Mother Nature contributes to those SEPs as well. We see a lot of special opportunities throughout the country that does that. Plus, we want to make certain that the programs that we offer have the ability to be delivered in a manner in which our audience is able to receive that information and digest it. And so we need systems that allow us to present in person or virtually or a combination of the two. And that's because over the last couple of years, our population's been trained to receive information that way. I mean, for almost a year, for many of us longer, where folks were visiting their doctors virtually, be it a primary care or specialist. They were doing prep work for hospitals virtually. They're dealing with some of that same type of here's before the appointment work with dentists. We've even celebrated our faith online, and many organizations continue to do that. So we have a population that is much more open to receiving this information. And for us as agents, that's very important because it gives us an avenue to adequately describe and help folks understand their choices and the programs that are available to them. But it also allows us to be much more efficient with our time because we can do some things virtually, cut down windshield time, all kinds of interesting ramifications that have been brought about by current circumstances that allow us to work more efficiently, compliantly, and deliver the message in a manner in which folks are open to so they can understand the choices they have. So what we have today is an introduction of a partnership with our friends over at National General. We have a guest presenter today that is a longtime friend, and we welcome him to the arena here, so to speak. And so we're going to, at this time, turn over control of the presentation to our friends with National General, and specifically the Vice President of Senior Product Sales, Mr. Brian Durheim. And Brian, I am going to turn panel over to you.
All right. I think we're ready to rock and roll. The technology worked. That's half the battle, as John talks about, with us being mostly at home in this new world that frankly between I'd like to go back to more of the old world, if you will, and it seems like we're getting closer and closer by the day, but we'll see where we shake out in that thing. But John, I appreciate the introduction. It's good to speak with you again. Excited about this today, and excited for the partnership with Premier, and equally excited to speak with all of you regarding our new Medicare supplement product that we just launched. As John mentioned, I'm Brian Durheim. I'm actually sitting in today for a gentleman on my team by the name of Craig Rydzeski. Craig wasn't able to be here today, but Craig's a stud. He's great to work with, and hopefully many of you will speak and work with Craig as we continue to go forward and all grow together. Let me flip the slides. John, you tell me if things are not flipping appropriately, and I think we'll be good.
Working well.
All righty. So a little background on National General. We go all the way back to 1939, but many of you may know that we were actually acquired by Allstate at the beginning of last year. And so, the core question I've gotten a lot over the last couple of months is like, well, Brian, like, what are you? Like, are you National General? Or are you Allstate? And usually my answer there is yes. So like for whatever sort of, I'm Allstate. I'm an Allstate employee. We're all Allstate employees, and we are going through a rebranding process to where you'll start to see less orange and blue and more blue, I would assume, in the near future. But be that as it may, agents typically ask, well, like, Brian, how should I refer to this? How should I speak to this product, right? Because it's National General, yeah, but if it's all owned by Allstate, it's akin to many of the other Medicare products that are out there, right? It doesn't matter whom you offer currently, whatever your current flavor of the week is for Medicare. Almost all companies have various charters, and so agents that have been in this business for any period of time usually are well versed in kind of talking about, like, hey, it doesn't matter which one of the Mutual Omaha charters it is, it's Mutual Omaha, right? It doesn't matter if it's Aetna Health and Life or Ascendo or Continental, like, it's all Aetna, right? And not too different with us. At the end of the day, it's really Allstate. This is all owned by Allstate. It's all ultimately insured by Allstate. Because of Allstate, the AM Best rating of the Medicare product, or I should say the charter for the Medicare product, is A+. And when you really put that name behind what we're doing, it really, in my belief, puts us in a much different light, because there's not one senior that has not heard of the name Allstate. As a matter of fact, I just learned recently, 1/3 of America has an Allstate product of some sort, whether it's auto, home, some of our health products, whatever it might be. They do warranty products, they do kind of anything and everything it feels. 1/3 of America has it, so we're one of the largest insurance companies. We're a $50 billion company, and I'm super excited that as we've gone through this acquisition and this transition to Allstate, that the leadership of Allstate is super excited about the opportunity to grow in a really tremendous way of the senior market. So next, I'm going to show you the Medicare product that we've launched, and I'll get into the details. I briefly, just if you could oblige with me, I want to give you a background that you might not always hear in terms of how we got to this point, right? So as you just heard me say, the Allstate leadership is excited for this. That's code for they've put a big investment around this product, and really more like my division, or our division, I should say, overall. And furthermore, when I've been working with our product team over the last year, I really wanted to get to a point where we could do something different, because I'm starting to get the sense that, the days of just, hey, we've got a new charter, and guess what? It's got competitive rates and competitive commissions, and it's $1 less than like whoever you're offering before. Like, there's a gamification element that will probably always exist there, but I think that the smart agents have gotten wise to that game, and they've not let the shiny object of $1 savings move them off of more core carriers. So what we did is we wanted to do something different, and knowing that we want to grow tremendously in this space, I also said, hey, I want to do something that's not only different. I don't like the idea of just trying to be like $1, cheaper for like the next 12 to 18 months until someone else comes out with the next charter. I also want to have something that has more longevity to it, something where it's not the short-term play, because I know we're going to need a few years to get to the growth that we want to do on our end. And so what can we do that's got a little bit more sustainability to it? And so what our team did is they went through and they hyper analyzed every single component you can ever imagine as it pertains to claims. So what do claims look like for folks that have household discount? What do claims look like for folks that don't have household discount? What do claims look like for folks based upon age? What do claims look like based upon state? 3-digit zip code, even 5-digit zip code. They've hyper analyzed everything. And the goal of that analyzing is to determine where is there savings that not for us to hold on to for margin, where's the savings that we can pass back to your customers in effort to give those folks, it won't be 100% of the folks, but even if it's 60%, 70% of the folks that you work with, and you can give them significant savings, not like $1 or $2, but $10, $15, $20, sometimes $30 depending on the state, sometimes more depending on who you're offering and who they currently have. That's where we wanted to be. And so with that, we came to what we call the NatGen MedSup multi-discount plan. It gives you, there's 4 different discounts that are available. If you were to put them all together, you can pick any of the discounts or all the discounts. You can get up to 25% savings. For those that have offered our products before, you'll know that on February 1st, we actually increased the commissions. And so the street commissions on F and G used to be 21%, they're now 22. And the street commissions on N used to be 21%, and they're now 24. We've got one of the slickest e-apps, really easy online signature methods. The most notable one that is used most frequently is our security question feature. You can ask something like a mother's maiden name, and that suffices. And then lastly, the e-app not only has an instant decision where we can give a decision within, on average, 15 seconds, but furthermore, we've got a data warehouse that ties to all of our systems, which includes our admin platform, and therefore it can do a call and response and create the ID card on the spot. And if you'd like, you can send that ID card or print it off for them. We, of course, will still send it to the client in the mail, but just giving you the technology to service your clients in a much more instantaneous way that we're looking to do. Here are the discounts. The first 2 are kind of an either or. So the first 2 are household discounts. The first one's roommate of 7%. And we've always historically offered a roommate of 7%. What we've added is a dual applicant of 10%. I want to pause on this one and talk about this for a second. What this is not a dual policy. Now there's a couple states where it has to be dual policy. I believe those two states are Ohio and Oklahoma, if memory serves. But broadly speaking, I'm not a big fan of dual policy, and the reason why, and I think agents will know where I'm headed with this. If you've ever tried to sell a dual policy, when I sold Medicare, what I didn't like about dual policy is it gave me a chance to have egg in my face. What do I mean by that? What I mean is, it's like, hey, this is a dual policy, so as long as you both get this, you're gonna get X percent, whatever the number is, 7%, 10%. You know, the one when I was selling, it was only 7%, right? You both got to get it. You submit the husband and wife applications. Here's, you know, inevitably what happened: husband got declined, wife got approved. Then what happens next? You call them up. Good news, bad news. Good news, Mrs. Jones, you're approved. Bad news, Mr. Jones, you're not. What does Mrs. Jones and Mr. Jones say? Well, that's great, but you know what? If we're not both approved, and if we've now lost that discount, which is probably the center reason why we applied for this, we're good, and you just lost both sales. With our dual applicant, if you get to a spot where Mr. Jones is not approved but Mrs. Jones is approved, at least with us, you can retain the 10% for Mrs. Jones. They just need to apply. They don't need to both be issued. So you can get to do it. So if you've got a husband and wife, as long as you're just willing to submit the application, you get 10% in your back pocket for a household discount. Furthermore, anyone that's willing to pay annually, you have another 10% you can take off the premium. John had a slide up earlier, I think I wrote it down, said that 50% of seniors have less than $63,000 in their savings. I'm assuming that means 50% of seniors have more than $63,000 in their savings. With annual pay, you kind of just need like $1,200-1,300. We don't need 63,000, right? As long as they've got, you know, whatever the number is, depending on their state, $1,200, $1,400, $1,500 sitting in their savings or in their checking, and they're willing to pay that all up front, they can get a really substantial savings of 10%, right? And I know a lot of seniors just like in discounts in general. Shoot, myself, I kind of do that on my car insurance. I think it's like 3%. I get a 3% savings on my car insurance if I pay annually. So it's like, yep, you're darn right, I'm going to pay. Is that for everyone? No, there's going to be some people who are like, you know what, that's great, but I don't have that option, you know, and that's fine. But I think it's going to be for a lot of folks. Last but not least is we offer what we call an activity tracker discount. Think of anything that records your steps. Fitbit and Apple Watches are the obvious ones, and those are up on the screen. But outside of that, most smartphones record your steps. What you have to do to get this discount is you apply for it within the e-app, and the client has to agree to, at some point, connect to our platform to share that data. We ask that they do that within 30 days. In reality, we're not checking for the first year. But we will check on renewal, and if on renewal they have not shared or connected to the platform, they could lose this discount upon renewal. But ultimately, with this activity tracker discount, as long as they share their steps, they'll get the 5% discount in perpetuity. And no, we're not saying like you have to do 10,000 steps to qualify. It's just simply just agreeing to share, whether they're doing 1,000 a day or 10,000 a day. I'm sure our actuaries would prefer we get the folks that do 10,000 steps a day, but that piece of it truly doesn't matter for the sake of retaining the 5% discount. And so if you've got a dual applicant, 10%, the annual pay 10%, there's 20. Some people are gonna like the idea and okay with sharing the data, some people aren't, but you're gonna have, you know, in a lot of situations, anywhere from 20 to 25% savings. So that is how you get to the 25% savings with our multi-discount product. From there, there's one other thing that we did that was really at the core of it, which is when we were hyper-analyzing all of those claims, what we found in the performance was folks based upon the bill chart also had a difference. And so we created a third underwriting class. Typically you do preferred and standard. That's what most carriers do, right? We added a third. So we took our preferred underwriting class and split that out into two. It might be small on your screen, but I've got a kind of a snippet of our underwriting guide that shows our height weight chart. And on there, if you look at a 6-foot individual, it says it's a decline if they're less than 136. and it's a decline if they're more than 296. And there's all this stuff in between. Before we launched this product, you could be a 6-foot individual and you could weigh from 137 to 259, and you'd be approved for preferred. And today, you could weigh from 137 to 259, and you'll still be approved for preferred. What's different is if you're in the 137 to 220 category on the left-hand side here, those folks perform a little better, and we're going to put into a different rating class that we're calling Preferred Select, and generally has a lower rate than the preferred. We'll still approve those at 221 and 259 on the preferred that we approved them last year on. So it's not like we're only taking the healthy of the healthy, but it's one more way to get a little bit more savings. Now you'll notice it's an underwriting class, not a specific discount. I'll talk more about that in a moment, but really think of it like that. The discounts are applicable regardless of the underwriting class. You could have a smoker that's 400 pounds coming through on open enrollment. They can, if they're willing to pay annually and it's a dual, you can still get 20-25% savings on those discounts. Those discounts are available for anyone and everyone. The Preferred Select is a way when you've got underwritten business to get a little bit more of a savings. Outside of the build chart, they do have to say no to the one question you see there on the screen, which is in the last 5 years, have they had medication prescribed for depression? Let me show you, if you kind of take a look behind the scenes, if you start quoting us on CSG, here's what you would see. If you went out to your specific state and your specific zip code and you start running a whole bunch of quotes, you would eventually see what I'm showing you in the chart. So I'm trying to save you some time in that vein. What you'll see is when you quote our preferred, our rates are the same at 65 and 66. And then after that, they go up about 3% a year. And frankly, that's what most companies do. Some companies will hold it till 67 or 68, and then they'll go up 3% a year. But you know, you've probably, for those that have been doing this business for any amount of time, probably already have recognized that. What we do with, and that's that kind of gray line there that's going up and to the left. The green line's the Preferred Select line. And so you can quote a 65-year-old, a 68-year-old, or a 72-year-old, and whatever the rate is, the rate will be constant amongst all of those ages. And then after 72, it will go up about 3%. Okay. And so what that creates is I'm comparing kind of preferred to Preferred Select. But if you were to really look at it relative to market, what it is when you've got discounts, if someone's going to pay annually, we're going to win hands down. That's just the bottom line, right? It's pencils down. NatGen's your company. And so if you hear nothing else from me, ask them. All med subs are the same, but there are some companies now that offer discounts if you pay annually. Would that be an option for you? Could you pay annually if there is a discount? And if the answer is yes, we are your company now. And oh, by the way, if they're even willing to share their steps with us, now 10% becomes 15%. And then if it's a husband and wife, 15% becomes 25%, right? So you can really get some savings there. And I don't care what underwriting class they are. If you have those discounts in play, we're going to win on rate all day long. And we're not going to win by $1 or $2. We're going to win by a lot. But let's say none of the discounts are applicable. And we're just, they're not going to pay annually. If you look at our Preferred Select, it's designed in the vast majority of the states that it's in to win on its own. And then what's cool is those additional discounts are really cherries on top. And that is how you can get this Goldilocks zone of $20, $30, $40 a month savings relative to the next cheapest carrier. It's pretty cool. This is where it's available. The green states is available now for 4/1 effectives. Missouri's coming next. That will be launched here shortly for a 5/1 effective. And then many of those blue states, we actually have product in right now, but it's what I'll call last year's product or the existing states that don't have this new multi-discount feature to it. It just only has our 7% roommate. So the dual, the annual pay, the wearables, those are the three things that we've added with this new product. And so what you're going to see is in May and June, we're going to have some more releases of states, and many of those blue states will go green in May and June, okay? Furthermore, in terms of kind of embedded benefits, we've also added one other, which is Amplifon. We've worked with these folks on our DVH product for quite some time for hearing aids. What we've done that might not be apparent at first glance with this slide is we've made it into a copay model. So instead of this just generic savings discount program, there's now, when the consumer goes and contacts Amplifon to start shopping for hearing aids, they have different price points and different hearing aids at those price points. The lowest copay price point is $695. So there's, I think it was 30 different models that are available from multiple different manufacturers at a $695 price point. But if they want higher technology, something like Bluetooth, something like a fall detection, all that exists at higher price points. So it's gonna be a matter of what they want, but there are hearing aids that start at $695. If they buy the hearing aid, they also get a free year of follow-up care, 2 years of batteries, which can add up a fair amount, and probably most importantly, a 3-year warranty. You know, so even if they step on it or lose it, it'll be replaced. So that's now automatically included with the MedSup. And then we've always offered the Active and Fit. With gym memberships, it's a constant debate of like, oh, do you do silver sneakers? And the answer is no, we do Active and Fit. And is the gym free? The answer is no, it's $25 a month. They can go online for free if you know, if they like being in the house, and you know, COVID's been a blessing to them, then they can go online for free. But it's $25 a month, which is better than the 40 or 50 or 60 that sometimes you've got to pay for some of these gyms. The other cool thing, 2 things, is one, there's not only no contract, but furthermore, they can change fitness centers at any time as long as they're in their network. And secondly, it allows us to keep the pricing really competitive. The unspoken truth about these programs is, while I love them and I know it garners a lot of interest at purchase, as a guy that kind of can see all the data behind the scenes, no one uses these, at least not nearly enough to justify the additive expense it would be to add free gym memberships that everyone then would have to pay for. So what we're trying to do is we're trying to give something without increasing the overall premium too much. And so we feel like we're kind of threading that needle with Active and Fit. That's our Medicare product. Super excited about it. I will now, what I want to do is I want to show you our DVH. Our senior dental vision and hearing product has a passive or an optional network with Aetna. We've got a partnership with Aetna in that vein. You can get 25% day one coverage on major services and up to 100% coverage on the basic services. In the theme of discounts, we've got discounts here too. We have a standard and preferred pricing model in our dental, which is kind of unique. So if they've had any, I'll call it just major services in the last 12 months, they get our normal standard pricing. But if they haven't had any major services, they'll get another 10% discount on the dental premium. And last but not least, there's also a 10% bundling discount. And so if they buy the dental in the same shopping cart with the MedSup, they'll get another 10% there. And so just kind of one more way that you can lower the premium with us. All the blue states is where we offer this product. This product has gotten really popular with us over the last year. And then we've got a couple more in those orange states coming hopefully next month. We have 3 different plans to pick from when you look at our DVH product. Level 1, 2, and 3 kind of going left to right on your screen. And so if you, I'm going to show you kind of all the different benefits of those, but the level 1, 2, and 3 will stay constant. So all of them have a $50 deductible, and all of those deductibles are waived on preventative services. All of them have 100% coverage on preventative. So that piece is easy. Now, as you boil down, level 1 and 2 do 25% day one on basic, 50% after a year. Level 3 does 50% day one on basic. That's like a filling. And it actually goes up to 100%. It's the only plan that goes to 100% on basic services after a year. Major services in level 1's not covered. It's designed to be inexpensive. It's like 16, 17, 18, 19 bucks a month in most states. Someone that just wants their cleanings and, you know, basic services. Level 2 covers major services and it covers dentures, but it does not cover implants. It's a $1,000 plan, then it becomes $2,000 after a year. Level 3 is the most popular and it's the richest one. That one, 25% once again day one, 50% after a year. 25% on major services leads the market, whether you're talking level 2 or level 3. The other difference with level 3 is implants are covered, and there's no specific limit on implants. That plan's $1,500 for the first year, and then after a year, once you hit year 2, it's a $3,000 dental plan. The vision is optional, so if they want to pay for it, they can, but they don't have to pay for it. They don't have to get it. You know, either you've got glasses and you've got a need for vision, or you don't. So we make it optional. There's 2 different vision plans to pick from here. One gives you glasses every 24 months on level 1. Level 2 gives you glasses every 12 months, and you're going to be able to get a bigger or a better set of glasses ultimately. When you look at the lens packages, we have more than what's typically included in terms of these lens enhancements. So polycarb, scratch resistant, UV protection, all those actually included free of cost on level 2. On the vision side, we've partnered with Avisus, and what I like about Avisus is they do very, very well on the retail side. And so if you just look at retailers, and retailers admittedly in the vision world are getting kind of a growing share of that market, they've got the widest retailer access points out of anybody. The two big ones in retail are Walmart and Costco. They have both those. They also have Target. They have Sam's. They have Pearl Vision. They have Vision Works. They have America's Best. And so on that retail side, they do really well. They also have independent providers as in addition to that. But the retail side, frankly, is what they're really known for. So I'm just going to very quickly touch on this last product. We have what some would call a hospital indemnity plan, but don't think of it just like a hospital indemnity plan. It's called a senior limited med plan. It's in the states that you see right there, and this is something different. I'm not going to go into a lot of detail here. I want to just give you a sense of what you could do with this product. This product, let me jump to the headline here. This product right here has two sets of plans, base and max. Your base plans will be like hospital indemnity. Those are fine plans for the purposes of covering out-of-pocket expenses, co-pays, deductibles, typically in conjunction with the Medicare Advantage plan. But I want to talk to you for a moment about these max plans. Here's what the max plans do that nothing else does out in the marketplace. If you cannot get onto Medicare and you're 65 plus, you have very little options. Think of max plans. Why? Because if you can't get on Medicare, there's kind of two reasons why you can't get on Medicare. Number one, you late enrolled. If you late enroll, you're not allowed just to jump on it at any point. You got to wait till the general enrollment period at the beginning of the year, which is in first quarter. And then if you sign up as a client and you get with your agent during GEP, then you can go on in July. But if I don't contact you till July and I say, hey, you know what? I never signed up for Medicare. I just got Part A. I want to hop on, and I'm already 67, but I got my Part A when I was 65. If it's July right now, I can't get on. I got to call you back in January, and then I can get on the following year, July. What do you do for those folks? Some agents say, well, I sell them ACA. You can't. They're already on Part A. There's literally no options for those folks. There's 1 million people a year that late enroll. Do you have 1 million clients in your book of business that late enroll? Obviously not, right? You're talking with people on a regular basis about Medicare. But I have many agents that I'll hear that will say, yeah, I've got a few a year that I run across, right? In those instances, you need to call me or Craig. We'll give you a quick rundown on how these plans work. They're essentially like senior indemnity plans, limited med plans. They're a scheduled benefit. Are they as good as Medicare? Absolutely not. No. It's just designed to be better than nothing. And you're not going to be able to offer them anything when they late enroll and they've already got Part A, probably because they've already gotten Social Security, so they've thus been auto-enrolled in it, right? The other instance where someone can't get onto Medicare would be if they've been a permanent resident for less than 5 years. They've recently immigrated to the country. They can't hop onto Medicare for the first 5 years. And so that'd be another kind of bucket of folks where they would find themselves that they could be 65 plus, but cannot get onto Medicare. These plans have really high benefits if they want them. So like $5,000 for the admission, 31 days of $1,000 confinement for injury or sickness. There's surgery benefits. So there's a specific list of surgeries. There are tier 1s, and then everything else is in the tier 2 bucket. There's skilled nursing for 60 days. There's outpatient benefits. This isn't just a hospital indemnity plan. It's full blown. I want to end with this. If you haven't been on enrollnatgen.com, go check it out. You get on there. Once you get appointed with us, you'll be issued a login for your back office, and that same login will be used for our e-application. It is a slick tool. I would put it up against anyone else in the business. Once you get on there, once you get into the back office, you can either go directly to enrollnatgen.com, or once you're in the back office, you can just click on that quote senior in the upper right-hand corner, and it will take you there. We are on CSG as well. I know many of you use CSG for quoting. What they've done is they've added because we have multiple different rate combinations, they've added all those rate combinations. And so when you are looking at the carriers, if you hit these little down buttons that are on the right-hand side of the screen, that will expand and give you more information, and it will specify what discounts are assumed in those rates. When you first quote, you're going to see the monthly rate, and that rate is going to reflect, the lowest rate anyways, will reflect two discounts, our dual and our wearable or activity tracker discount. It does not reflect annual pay. Annual pay is shown when you click on the annual rate button that's on the left-hand side. On my screen, I've got a screenshot of it up on the top. When you click the annual rate button, that then adds our 10% discount. And what you'll see then is in this screenshot that I took of Indiana, we not only have the lowest rate by a few $100s a year, but we've got 4 different rate combinations that beat otherwise the most competitive rate in the market. So we're really excited about it, as you guys can probably imagine. So hopefully that was helpful. I've got Craig's information up here, but I also am happy to help and can be reached. My email is the same format as Craig's, brian.durheim@ng.com. And with that, if I can figure out how to stop sharing, there we go. John, I can turn it back to you. And I don't know if you want to do questions at the end, if you want to do questions now, but whatever's helpful.
We've got a number of, a few questions I think that would be helpful to address right now. And I think you did a pretty good job on one of them, but one of them bears repeating as well. Because of all the different discounts that are available, can they be layered on simultaneously, or is there a limit?
They can be layered on or stacked simultaneously. Yep. So you can do the roommate and the annual for 17. You can do the dual and the annual for 20. You can do all of them for 25. Any combination you can dream up is fine.
Awesome. And another question is, can we get the information on the agent support phone number details as well? And I think with the information you send me, I'll make certain that that's in the follow-up that goes out to everybody. So I think we'll take care of that on the back end, unless you choose to share that number now.
I don't have it memorized other than Craig's information, but I can, yes, so I would definitely work with Craig. It's insane how much he can get through in a day. Quite impressive. But we also do have an agency services line, and yes, I can get you that 800 number, John.
Awesome. And we'll make certain that goes out with the follow-up. There we are. So I thank you, Brian, for your presentation. What I want to do now is give folks a reason why they want to do this program through us here at Premier. We've got a number of different support programs, I think, that can make a difference for you in moving the needle, so to speak. And let's talk about them for just a moment. One of the programs that's available is because of the opportunities that you have for cross-selling and multiple carriers being made available to you, especially in the ancillary space. You have an opportunity in our Insurance Pay program to set up an agent profile, store your information in there, answer the questions that are common on contracting for different insurance carriers, and do things electronically. Everything's going electronic. Back in the old days, a long time ago, at one point in time, as a carrier rep for a SNP program, over 70% of our applications were pended because we couldn't read the handwriting on the application. This eliminates that, obviously, across the board. And that's why you're seeing, one of the reasons why you're seeing such a push for electronic processing of different programs. We also offer discounted E&O to our qualified agents. 1, what makes you a qualified agent? Well, you got a contract with us. 2, why would we discount E&O? Well, we realize that as an independent agent, you have an opportunity to contract with multiple organizations. No one has every product. And if your choice is outside of our purview here at Premier, while we offer a discount for these E&O packages, if you go through just our program, we do offer a slightly increased rate on this that enables you to cover yourself wherever you go for contracting. So it's not being added for a blanket E&O policy for one program, and you have to worry about how you can satisfy the errors and admissions requirement that enables you to contract with different insurance companies. You own this program, and it takes care of you wherever you contract and for any type of insurance program, basically. We also offer discounted continuing education courses through our affiliation with WebCE that enables you to keep your licensing in place. And you have an opportunity to pick up modified guarantee issued disability insurance programs on yourself, where it pays you a commission. So it protects your ability to earn as an independent agent. You're responsible for your own benefit package. This is a great way to add to it. As I mentioned when we started, today's presentation is being recorded and will be made available on our website and on our YouTube channel, but past presentations have been as well. An opportunity to glean a little bit of knowledge 24/7 as to tips as to how to market in the community, how to work in different spaces within the insurance world, the different niche markets, working with different carriers. It's all available on our library of past webinars and recordings, and it's across the board, not just in the Medicare and ancillary space. There are programs in there in life insurance and long-term care, a number of different programs that can be very helpful to you. Brian mentioned that National General is available on the CSG platform, and that's a perfect segue into our Medicare Center. For those of you that aren't as familiar with it as others, it is a program that's available to our contracted agents without cost. Boy, that's an old MA agent talking. I can't use the word free. It's free. It has a universal login that gives you access to 3 different quoting engines powered by Connecture, Sunfire, and CSG, and gives you the opportunity to use all of those systems through a singular logon, where you can also procure that all-important scope of appointment by multiple means, store it for that 10-year period, and make certain that you do that whether you sell them or not. Now, a scope of appointments not necessary for a Medicare supplement program, such as what we've discussed today with National General, but generally that discussion leads you to, well, what about my drug coverage? So we want to make certain that we not only maximize our sales opportunities, but we're doing it compliantly. This does that so very, very well. It also gives you a complimentary customer database where you can manage and track your clients, do those year-over-year reviews much more simply, and work throughout the year to stay in front of your book of business in order to drive up retention and persistency. There's also a piece in here that's not listed on this slide, and that's a resource guide that gives you also different sales tips, sales scripts, different pieces that can be helpful in helping you sell as well. Many of the carriers will come out with different incentives that enable you to earn additional dollars through the sales of their products. You can't do that for MA and PDP products, but you most certainly can for ancillary products, Medicare supplements, final expense, a number of other programs. And those incentives may well help you qualify for carrier trips and incentive programs offered by our organization as well. And so we have a page on our website that lists all them, so you have that detail easily available to you. We do have programs also to help get you in front of folks in order to sell, and that includes complimentary contact lists butted up against Do Not Call, where it's free or at a discounted rate, and then different programs to help you market to the centers of influence in your community through different outreach on a live basis, so to speak, live or Memorex, to quote an old commercial, because the retail marketing programs, they are still ongoing in certain circumstances, much more active during AEP, but we want to make certain that any investment you put into that with dollars and time, you get an more than adequate return on that investment. We have programs that can help you do that. We also want to make certain that you're able to reach out to centers of influence in the community that might have a big draw for attracting folks to visit with you, or actually are delivering upon the services that we're marketing as part of our insurance programs. So working with faith-based organizations and providers are part of the detail that's recorded and on our websites as well. Certain carriers will generate prospects for you as well. We see that mostly in the MA and PDP world during AEP or working with D-SNP programs throughout the year. That is a symbiotic relationship where you scratch the carrier's back, they scratch yours. You'll see the support that comes to you in that area. We do have internet lead programs and direct mail support, a great T65 locator, and a system to follow for referrals that can take one lead and go forth and multiply, so to speak, with that. That direct mail program is a deeply discounted program based on production through certain lead vendors, but there are two of them. There's one for health programs and then one for final expense. So you can actually qualify for 2,000 pieces of mail if you are productive in both areas. As I mentioned, we go through specific lead vendors for that. We do so because we vet those vendors. We want to make certain that the systems they have in play adequately support the dollars that you're investing in those lead systems. That gives you the opportunity then to maximize not only the returns that you're getting off the mails, but the mail that comes back in, but also that you're getting full value out of that. You're able to sell it quickly. We do some different things, and their systems come into play to do that. And we also vet the letters they send out to make certain that we stay in compliance. We also have programs if you are looking to fill holes in your schedule or work with perhaps a more limited budget, or you're purchasing direct mail responses that never been touched, still fresh, available throughout the country, varying rates based on the programs, the time of year, and the area. It's kind of supply and demand in that area. But it's a great way to fill in your schedule and do some things with folks that have raised their hand saying, hey, give me some of that. That internet lead program that I referred to is through Facebook, and it gives you an opportunity to pursue final expense or Medicare leads through that program as well. And that T65 Locator, it too is a complimentary program. Yes, as JJ Walker says on the TV commercials, it's free. Well, it gives you the opportunity to download this program on your smartphone, register through your smartphone. They'll verify you have a contract with us. This will pop up, and it'll actually give you the ability to find people in a certain demographic, age area, age bracket, the area that you're pursuing, and give you an opportunity that if you are one of the brave and the strong that door knock, well, do it for the right product. You can't for MA or PDP, but you can for MedSup, you can for final expense, you can for dental. It's a great way to fill between appointments and also become more familiar with your target market as well as to where the folks that you're pursuing in that ever popular T65 market or whatever demographic you lay out, where they actually are in the area that you're marketing. That referral program, now it's also important to utilize that not just with the sales process with folks that you're currently speaking with, but it's a great way to go back to your book of business, keep them involved with you as their agent, and solicit referrals from them as well. It's a great way to organically grow some leads at a minimum of cost. So we offer all these programs simply because we want your business. We want to be referable to you. If you're working with a Medicare agent success manager in Norfolk, they're going to help you with our programs. If you're interested in help with long-term care programs, we have people in our organization that can help you there, or life insurance, long and short-term care, the categories that we discussed as part of the portfolio as we started. Well, we have folks there that can help you, and we're going to help you grow your business in that area. So we're going to check one more time for questions, because this is the point in time where decisions come into play. Having National General as a partner for you in the Medicare supplement space is a very valuable addition to your portfolio. And it is also one that you can enact very quickly. Say, hey, I want me some of that. Put it as part of your personal marketing plan and put it in play as quickly as possible, because I think it'll make a difference for you in your market. And as John Wayne said on the movie The Cowboys, slap a piece of bacon in that biscuit, saddle up, let's ride, because we're burning daylight. You don't have to wait. These don't require certifications. They don't require a lot of intricacies to pedal through in order to make certain that you can offer the program. We want to make certain that this becomes part of your portfolio and that you go forth and make it an active part of your personal marketing plan. So all that said and done, this is the point in time in which I thank you. I thank you for the investment of the time that you put in with us today to learn more about National General and the program that's being offered there. And for those of you that have done business with us in the past at Premier, I thank you for that business. I sincerely do. For those of you that are looking to do business with us in the future, I thank you for that opportunity. But I thank you most for the time that you invest with us, the relationship that we have in our building. And you can reach us at 1-800-365-8208 or through our website at premiersmi.com. When you dial in, if you're working with someone already within Premier, they're going to help you in the different areas. If you're not with us yet, we're going to set up a subject matter expert for you in order to make you successful in your chosen space. And we also want to make certain that we give you the support that's necessary in order to grow your agency and your book of business. So until we have the opportunity to visit with you again in the very near future, I wish you good selling. Thanks so very much. We'll talk to you soon.